Okay, in terms of how exercise can help men restore sexual function following prostate cancer treatment, we have some exciting new evidence in the research showing that exercise can actually minimize the reduction in function, in erectile function, experienced following prostate cancer treatments. And in addition to this, we've seen that exercise can be an effective way to help maintain libido or sexual desire and actually help restore sexual desire following prostate cancer treatments. So a concern for some men following a radical prostatectomy is the potential increased risk of developing a hernia and how exercise can kind of influence this. Now, at the moment, we don't have any scientific evidence to show that exercise can help prevent the development of hernias, or exercising when you have a hernia can actually help in that function. But what we do know is that exercise is an effective way of maintaining the structure and the function of the musculature in the abdomen, and this can help facilitate or prevent the development of hernias. And I would definitely advise anyone who has any concerns about developing a hernia or has a hernia to seek out professional advice from a physiotherapist. So for many men treated with androgen deprivation therapy, accelerated loss of bone mass and the risk of osteoporosis is a common concern. Now, the good news is that exercise is very beneficial in counteracting this bone loss and minimizing the risk of osteoporosis. And very specifically, what you need to be doing is weight-bearing activities. So these are activities that require impact on the bone or a stimulus to the bone. So things like walking and jogging at a high intensity. Resistance exercise is very good, so lifting weights, it puts a stress on the bones. And research coming out of our lab indicates that impact exercises is something that's very effective to stimulate growth or remodeling of the bone, and this can help minimize that loss. Now, these impact exercises are a sophisticated type of exercise prescription, so it's really something that you want to be doing under the supervision of a qualified exercise physiologist. So the impact exercises that we get men with prostate cancer to do are simple things like marching on the spot, jumping, skipping, with and without a rope, hopping, as well as things like jumping over small hurdles and bounding and leaping. So these things can be quite challenging, and you can understand why it's important to have someone monitoring these activities who knows exactly what to do and how to keep your safety paramount. It's very common for men with prostate cancer to be experiencing a number of other health conditions, which can be quite serious, things like cardiovascular disease, diabetes, and so on. And these things make exercise even more complicated. And there's things that, as exercise physiologists, we need to take into consideration in terms of what we monitor and how we prescribe our exercise. Now, the biggest thing I'd like to say is that any of these other chronic diseases certainly isn't prohibitive to starting an exercise program, but certainly to consult with your general practitioner and also with a certified exercise physiologist in order to ensure that the exercise that you are doing is individualized to you, takes into consideration your health concerns, and is safe and effective.